No, they weren't certainly expecting the numbers to fall significantly, but this is one of the Prime Minister's key pledges, is to reduce NHS waiting times. And when you look at the context, Wolf, what's happening here is you have demand increasing, the NHS saying that this has been the busiest time ever for the summer months for A&E, attendances, ambulance call-outs. So we have demand rising through the summer months, and then you have to factor in the industrial action that's been taken by not only junior doctors, but by consultants as well. Now, that is always going to have an impact. The last few days of junior doctors' industrial action, 110,000 appointments had to be cancelled, bringing the number up to nearly 800,000 since industrial action began. And that was in December last year. We had the nurses at the beginning, and we've had the various specialty professions also taking industrial action. And then the nurses, that was resolved, and now the junior doctors and the consultants. So every time there's industrial action, the routine appointments, the elective surgery lists will rise because the hospital can't accommodate elective patients and carry on functioning as a normal hospital. So it is a mixed bag. There have been some gains, and the NHS will point to these gains and say that despite these challenges, we are still managing to bring some of those waiting lists down, not the overall number of 7.6 million. But if you look at the 18-month wait, that's a key target for the NHS. That's been reduced from 11,446 in May to 7,177 in June. But it was over 50,000 as recently as December. So they have made good progress on that. But there, the caveat is they were meant to be eliminated by April. And a total of 383,000 people in England have been waiting more than 52 weeks. Another key target for the NHS to start routine hospital treatment at the end of June. Now, this, again, is down slightly from 385,000 at the end of May. So the NHS and the government will point to these waiting lists and say, we're making progress, significant progress in some areas, despite the challenges of these industrial action impacting on that bigger number, the 7.6 million people who are still waiting for elective treatment. Remember, Rishi Sunak has made this a key pledge and a key part of his outline for the NHS and for the country to bring this waiting list down. But he says because of this industrial action, he simply can't do it. So they need to resolve these strikes first.